Okay, I think I'm recording and I'm going to go ahead and share my screen. Okay, so now hopefully you can see my PowerPoint. And now I'm just going to go into presenter's view. All right, so the name of my PowerPoint, my presentation is Managing Sudden Idiopathic Sensorineural Hearing Loss. So just a little bit about my patient. He is a 6-year-old male. He works as a construction executive. It's a desk job. He is really heavily reliant on communication, talking on the phone. He's married, no family history of hearing loss. He does have a history of noise exposure. I'm going to try one thing to try to get captions going. Let's see. Okay, hopefully that's working and you're seeing that at the bottom. I've had some technical difficulties with recording, so this will be my last time. Anyway, so no family history of hearing loss. He does have a history of noise exposure. He was an electrician and he did work in more of the grit of construction, so he had some noise exposure there. He did develop something called iritis in 2005. I have a picture there on the right of a woman's eyes. So that's just swelling and inflammation around your eye's pupil, and he manages that through consistent steroid use. All right, so now in 2008 is where we're kind of start his audiologic history. He did have a sudden profound sensorineural hearing loss in the left ear. He didn't seek treatment right away, and so by the time he saw an ENT, steroids or any type of prednisone was no longer going to be helpful or reverse that sudden loss. Was an unknown etiology, so by definition going forward he was SSD. He did develop tinnitus in the left ear, and due to limited benefit or limited impact on daily life, he didn't pursue amplification. He was recommended a Baha bone anchored hearing aid consult by one of our otologists, and he did go through with the consult with one of our audiologists, but ultimately decided not to go through with it because it was a surgery and he did have a fully functioning right ear. So moving forward, the next time he has an audiologic change was 10 years later. So he had a sudden decrease in the right ear in October of 2018. So this decrease, we didn't have an audiogram, but just from notes that we kind of saw, written notes, it was a moderate sloping to profound sensorineural hearing loss. When word rec was presented, it was 80 at 80 dB. It was poor. And this is when the patient started having severe imbalance and dizziness. He now had tinnitus in both ears. He already had it in the left, so now he has it in the right. He had heavy congestion at the time. He did go to the ER because of how he was, obviously his experience from 10 years ago. He knew that there was a treatment that could have been done if he sought it sooner. And so now he suddenly went to the ER immediately and they gave him oral steroids. So in the months following the sudden loss, they thought it was labyrinthitis, and that makes sense because if you just think of this sudden loss and taking away his prior history, you have that pressure, vertigo, imbalance. So I would think labyrinthitis as well. So he continued to be on oral steroids consistently, and without the steroids, his hearing would significantly decrease and his vertigo symptoms would become severe. He did develop oscillopsia, and in those following months, it's important to note that his tinnitus, hearing, and vestibular system would fluctuate daily. So once doctors kind of began to look at previous history and other comorbidities, they kind of had some other theories about what could be going on. So that was in October of 2018, and now going into kind of 2019, he was managed at an outside clinic, not here at UC Health, but we have some records from there as well. He continued to take prednisone daily for the fluctuation of his hearing and in the fluctuation of his eyes. He had no amplification in the left ear. He tried a bicross in hearing aid, however, did not find it helpful. And because he had that hearing fluctuation, his audiologist made him several different programs to choose between, kind of depending on how he felt his hearing was each day. So a couple months later, April in 2019, it was his first audio back here at UC Health. He's just reestablishing care. He was originally found benefit from the hearing aid and then kind of wanted to look into his other options. And so most of the case history you already know from previous slides. The only differences are really highlighted above. He still has that bothersome tinnitus. He thought it was interesting to note that his right ear and left ear, one was musical fluctuations and the other was like a high-pitched typical tinnitus. He does continue to have that imbalance and vertigo and recently developed oscillopsia. So clear canal, visible TM, type A TIMPs. His right ear was a moderate rising to mild, sloping to severe sensory neural hearing loss. And the left ear was profound no response, which we knew from a couple years earlier. So again, he has a poor word recognition in that right ear at 80 dB presentation. And so that hearing aid is really not giving him much benefit. And so he just really wanted to kind of hear about what we thought might be going on and some potential options for him going forward. So after this audiogram to reestablish care, he met with one of our otologists, Dr. Cass, and Dr. Cass kind of got the ball rolling on some things that we could try. This is one of my favorite patients. I've been following him since the moment I got here, and I'm really excited to share more about him and kind of what we've done and his story and where he is now. All right, I will talk to you guys in a couple weeks. Happy Friday. Enjoy.